the administration is still lying about this government shutdown. Donald Trump, JD Vance, Mike Johnson, basically every MAGA Republican calling it a Schumer shutdown when that couldn't be further from the truth. All that Democrats want to do is to ensure that those that have their Medicaid coverage keep it. This has nothing to do with giving free health care to undocumented immigrants. As we know, and I repeat on this show over and over again, undocumented immigrants, it is illegal for them to get Obama subsidies. Completely illegal. But yet MAGA Republicans are making the case that Democrats want health care free for all, including undocumented immigrants. It's a blatant lie. No, they want what's taken out of this big and awful bill, which would put 20 million Americans without medical coverage, millions of Americans without food stamps. That's not a Schumer shutdown. That's Republicans that want to take your benefits away, the most vulnerable people in this country that are struggling. But Greta Van Susteren asked JD Vance the question, and once again, JD Vance lying to the American people about health care. Have a listen to this.
I'll bring it back to the United States. Domestic issues. I think probably the primary issue that every American cares about: health care, access to health care.
Yep.
Obamacare has not worked for a lot of people. Do you have, or does the administration have a plan? Because now the wars are at least hopefully getting behind us.
Sure. We do have a plan, actually, and one of the things that the Obamacare system did is that it really broke the insurance regulations in this country. I mean, so many people, if you go back to that early implementation period of Obamacare, even people who had really good health care, they saw their health care bills skyrocket by 100, 200, even 300%. You remember the famous promise, if you like your doctor, you can keep your doctor. A lot of people found because of the Obamacare regulations, they couldn't keep the doctor that they had built a relationship with over years. We want to fix that program, that process, and we also want to make sure that people can access affordable health care, because the great promise of Obamacare is that it would slow the increased costs of health care. It completely failed on that metric too. So we do have some things that we're working on. We've actually extended an olive branch to Democrats and said, if you guys want to come and have a conversation about how to fix this system, we'll certainly sit down and talk with you.
Is there a fix? Is there a fix?
I think there are things that you can do to make it better. I think the system, to pretend that we can fix such a complicated system, that logic is probably what led to the original Obamacare disaster. But I think that we can actually make the regulatory system of the insurance marketplaces work better. We can use reinsurance to make it more affordable for people with pre-existing conditions to get access to health care. And we can also make it easier for, look, if you're, let's say, a 30-year-old man who's completely healthy, you're going to want a different insurance product than a 65-year-old with some pre-existing conditions. I think that if we allow people to get the kind of health care plan that suits them, it'll actually lower costs. It'll get more people into the insurance system, which lowers costs for everybody, but it'll also make it so that people actually access good care. It is broken. The system was broken. We inherited a very broken system, and we do have some good ideas for how to address it.
Well, what are those ideas? Funny, I thought the question was, what's your plan? I'm sorry. Did anybody hear a plan in that answer? I heard what Republicans have been doing for 9+ years, which is complaining about Obamacare. Where is the replacement plan? I didn't hear a plan from JD Vance. Have they been keeping it secret for 9 years? I heard more complaining about Obamacare and no actual real solutions. We have things we are working on, JD Vance said. Why are you keeping it secret? You've been working on it for 9 years. What's the plan? All I heard was complaining about Obamacare. They have no plan. I'll tell you what their plan is. Taking 20 million Americans off of Medicaid coverage, taking their food stamps away, basically taking any government program away from you that could help you. Unemployment benefits, maternity leave, lowering taxes for the top 1%. They have no plan for all of you. And that's proof right there. You ask any of these MAGA Republicans, what is your replacement plan? And they'll start bringing up Obamacare. They have no plan. You can't complain about something if you don't have a solution to it. You couch assaulter, you imbecile. Donald Trump was speaking on Air Force One yesterday. And today, I just want to be clear, while many people are struggling to put food on the table for Thanksgiving, and this Ukraine-Russia deal is never going to work, what is Donald Trump doing today, as he's done 84 times this year? He's playing golf at one of his golf courses on taxpayer dollar. So a reporter asked him yesterday about the possibility that they plan to extend subsidies so those can continue to afford their health care. Keep in mind, if these subsidies are not extended, millions of Americans are not going to be able to afford the health care that they need. Listen to Donald Trump days before Thanksgiving talk about how he's probably not going to do that.
I mean, I like my plan the best. Don't give any money to the insurance companies. Give it to the people directly. Let them go out and buy their own health care plan. And we're looking at that. If that can work, we're looking at that. That's sort of take it off. That's what I like. Don't give the money to the insurance companies. They go out and buy their own plan. You give the money to the people. I like it the best.
Are you planning to extend those subsidies?
I'd rather not. Somebody said I want to extend them for 2 years. I don't want to extend them for 2 years. I'd rather not extend them at all. And maybe some kind of an extension may be necessary to get something else done, because the Unaffordable Care Act has been a disaster. It's a disaster. And I said it was when it first got put in. Unfortunately, we lost a couple of Republican votes, and the Democrats voted for it. It's a Democrat plan. And the premiums are going up, and it's the Democrats' fault. But, you know, they are negotiating with me. It's very interesting. They want to see something happen.
Who are you talking to on the Democrats
can't tell you
side?
who, but we have a lot of Democrats want this plan to happen. They would love to see the money go to the people, and the people go out and get their own health care. And there would be nothing like it.
Right, there you go again, complaining about Obama and complaining about his health care that he put in place, which is, you know, for lack of a better term, called Obamacare, but there is still no replacement plan. And right before Thanksgiving, Leonard, health care for 20 million Americans doesn't seem to be a top priority for the President of the United States while he's on his way to his resort playing golf.
He wants to send people a $2,000 check. And I'll just send them, you know, you have to send $2,000 a month to every single person. That's what it would come down to. And keep in mind, prior to Obamacare, 22 million people could not afford. This was really directed at the lower income people. This was directed at minorities in bad neighborhoods who couldn't afford it. This was a subsidy from the government to make sure that everyone had medical coverage. And the reason they did it was because the hospitals and the medical field was taking a beating, because people with no insurance, they still break their arm. They still break their legs. They still have heart attacks. They still have to go to the emergency room. They have to use medical resources. And that it was almost like car insurance, where you wanted to force everybody to pay so everyone would have coverage. And now they don't want to do the subsidies anymore because it's unpopular. Why is it unpopular with Republicans? Why are Republicans pushing back? Trump did say, it was reported in the news, I think the New York Post, that he did say he wanted to extend, or an idea was to extend the subsidies for 2 more years with a couple of restrictions. And it was the Republicans that pushed back, not the Democrats.
Yeah. Caroline Leavitt held a press conference earlier today, and as you know, her, Trump, Vance, they're blaming all the Democrats for the shutdown, the government shutdown, which is obviously categorically false. And I broke it down yesterday. I'm not going to break it down again today. I told all of you why Republicans are lying and how they're lying, and Democrats don't want health care for every undocumented immigrant. That is a bald-faced lie. I explained it yesterday. I'm not going to go into the details again. However, I want you to listen to the way Caroline Leavitt answered this question, because she's asked what I think is a very important one, which is, if you happen to be an undocumented immigrant and you're suffering from, let's just say, a heart attack, or you're bleeding out, something that is very serious, that you could lose your life, right? And you're dropped off at the ER. Should we help those people? Now, obviously, in my opinion, if you're any moral compass at all, you say yes immediately, right, Leonard? We would say yes, of course.
Any human being with
Right.
any compassion at all would say yes.
Of course. Correct. I agree. Listen to the way Caroline Leavitt answered or didn't answer the question. Have a listen to this exchange.
Should ERs check for immigration status before treating a diagnosed patient?
That's probably not a question for me to answer. I think that's a question for healthcare professionals and legal experts to
You
answer.
understand why I'm asking you? Because Republicans have been saying that Democrats want to give benefits to undocumented immigrants, even though it's against the law for them to get these benefits. I know there's some
Let me ask you, do you think that illegal aliens should receive Medicaid benefits? Medicaid benefits that go to the most vulnerable people in our country. Medicaid benefits that were designed to help low-income families and Americans in our country.
Notice how she doesn't answer the question. The question wasn't about
Just conflating Medicaid with services.
the question wasn't about Medicaid
It wasn't.
being offered to undocumented immigrants across the country. That wasn't the question. The question was actually a very simple one that anybody with a moral compass would answer. And you know, Caroline Leavitt, she walks around with that cross on her neck, but apparently we don't care about people if they're brown or if they're undocumented, even though they're human beings. The question was, if somebody goes into the ER that happens to be undocumented, that is dying, maybe a heart attack, maybe bleeding out, whatever the case may be, is it the Republican position that we should not help those people?
Like, oh, well, they're just going to have to die, I guess.
That was the question, right?
Right.
That's what I heard. And her answer or response was, well, you'll have to talk to the hospitals about that. First of all, I've never heard anybody at a hospital say, we're not going to treat you for life-threatening issues because you're undocumented. So that's number one. Number two, she says, well, we'll have to, legal people, we'll have to ask legal. It's not a legal issue. It's a human being issue.
Can I give a little background?
Yeah.
So in this state, for example, UMC is a state-run hospital. So they're mandated to take care of everyone, whether they're undocumented, whether they have ID, whether they have insurance. But you know who pays the bill? Once they do that, we do. We pay that bill through taxes. And the government, the federal government, doesn't get involved. But not every hospital has, if it's just a broken arm, for example, not every hospital has to take care of that person. But there are some mandated almost in every state. And so she's taken an issue, or I thought it was a terrible answer. Why doesn't she just answer the question and say, you know what, if the person's dying, yes, you have to take them in and save their life.
But Leonard, the reason why she won't answer the question is because we all know what the answer would be. If MAGA Republicans had it their way, they would not want an undocumented immigrant in this country to get life-saving health care if they're in the ER, because they are not pro-life, they are racist, they are bigots, and they only care about, I'm not even going to say they care about Americans. I think most of them care about Christian white Americans.
They're devoid of compassion.
Yeah.
I'll say it. If you have a dying person that walks into a medical facility anywhere in the world and you don't take care of that person, I would say that you're devoid of a conscience and devoid of any kind of
am I
compassion.
wrong? Any decent human being in this country would say, yes, if somebody is losing their life and they need life-saving care in the ER, no matter what the color of their skin is, whether they're documented or undocumented, we should help that person. Most reasonable people with a heart would answer it that way. Now, if you want to talk about whether they deserve Medicaid,
Well, that's what she did.
that's a different subject.
Yeah.
We're talking about life-saving care when somebody is dying and sent to the ER, and she wouldn't answer that
She
question.
conflated the two of them because Medicaid for undocumented is illegal. Sorry to interrupt you, but the listeners have to know it's illegal. It can't be done.
Right. And she calls herself a Christian, a person of faith. These people call themselves children of God, good, wholesome Christians. So I'm wondering what Jesus Christ would say if we have somebody in this country that doesn't have the proper paperwork, a decent human being, a hardworking individual that is having a heart attack, for example, and they're in the ER. And I'm wondering what Jesus Christ would say if Republicans told Jesus, we're not going to help you because you're not legal in this country. That is, again, I'm not a very religious
That's
person.
anti-Christian. I'll say it. I'm a
Right.
Christian.
I was just going to say that. I'm not a religious person, but I'm pretty sure that's anti-Christ. And that's who Caroline Leavitt is, and that's who these MAGA Republicans are. They are the anti-Christ, meaning they are anti what Jesus Christ would tell you to do. They are not Christians. They are fake Christians. And another one is called JD Vance, our Vice President of the United States, who started talking about ERs and using the term illegal aliens. Have a listen to what JD Vance had to say about this.
About illegal alien benefits. Look, the text is very clear, and I even saw, I think it was George Stephanopoulos in an interview with Mike Johnson, did a fact check that was totally rooted in baseless claims. It was basically Democrat propaganda. If you look at the legislative text that they gave us, they tried to turn on two separate provisions that would give health care benefits to illegal aliens. Number one, if you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits at hospitals paid for by American citizens? The answer is a decision made by the Biden administration that the Trump administration, working with congressional Republicans, undid. We turned off that money spigot to health care funding for illegal aliens. The Democrats, in their legislative text, want to turn it back on.
Okay, so first of all, Vance is saying that Trump and the GOP didn't cut emergency room access for immigrants illegal or not with their last budget bill. But what they will cut is the insurance coverage of 4 million Americans and double the insurance premiums of 24 million Americans. Also, that is a lie. Joe Biden didn't do what JD Vance is claiming that he did do. So again, the stance from JD Vance is basically, if somebody is dying in the ER, if they're undocumented, we shouldn't help them.
Well, wasn't he fear-mongering? Wasn't he saying, if we let these people get the care, then you're going to have to wait in a longer line because lines are long enough as it is. But can I clarify? Let me just clarify one thing. There is some limited medical coverage for people seeking asylum in America and refugees. When you end up coming into this country, there is a minimum amount of health care you can receive. Not illegals, not undocumented people, not people who have entered this country with bad intent, not criminals. And so what they're doing is they're taking a very, very tiny piece of what the law says, and they're trying to make that the standard. And and I don't even think it's clever, because it sounds like a lie as it comes out of his mouth, at least to me.